This is MED120. I am Dr. Nelson Garais. This is week 6. It is Monday, February 8th. And this week's topic, of course, week 6, topic 6. And I click on that. And it is, the topic for today is renal system, also known as your urinary system. So renal, we already know that word, al, pertaining to your kidneys, and urinary, airy, pertaining to urine. So of course, that's the big thing about the renal system. It makes urine, and that's important. So let's go now to, why do I always open the wrong thing? Always open, for those of you who are in Mac, for your, what do you call that? Your medical language lab, for whatever reason, Safari is not friendly for medical language lab and your textbook. So if you use Google Chrome or what's the hose is this? What am I on? Firefox. So I go to MED120. I go find my textbook. And then I go to ebook. I find urinary or renal system. Okay.
Chapter 7.
I gotta mute some of you. And again, just like always, if you need to ask a question, I'll be monitoring the chat box periodically. And what's the hoses? I will also have a, hopefully I can get through this relatively quickly. I can, then we can have a short Q&A. But again, I have to get off the phone for mandatory, like an emergency meeting. And like I said, it's about plagiarism. It's about the lack of writing skill in the undergraduate schools, which is School of Nursing, School of Health Science, School of Business, Culinary. But I reported back to everybody, hey, my class is pretty good. And my MED 210, 110 classes, they're, if you're in those classes too, overall is pretty good. I have no complaints about cheating or plagiarism regarding posts. So let's jump right on in. And who are the people in our neighborhood? Urologists and nephrologists. Now, urologist, logist, person who practices uro or the study of urine, right? So urology, they deal with, let's show you these structures. Kidneys, and these things are called the ureters, and then your urinary bladder, and then your urethra. Whether you're male or female, you all got it. Check it, right? Mr. Francis, I'll answer that question later regarding medical language lab. The best thing regarding medical language lab, do all of it on time as much as you can. Don't worry about the score. It's the level of completion. That's what we're looking for. So when we're looking at a urologist, they're good at this, the ureters, urinary bladder, and urethra. But the nephrologist, they're good at this, the kidneys. So if you have a urology problem, it's important. But if you have a nephrology problem, that's bad news because that's already kidney. So something like a UTI or a urinary tract infection, which starts down here and goes way up, once it becomes nephritis, that's a bad thing. You can have ureteritis, your ureters here. You can have cystitis, which is inflammation or infection of your bladder, or you could have urethritis, which is inflammation or infection of your urethra, or the tube that goes from your urinary bladder out to the toilet. So think urology, think ureters, bladder, urethra, and nephrology, think kidney. Now, another thing that urology does is they're good at erectile dysfunction for male patients. Now, if you have, female don't have erectile dysfunction, but they could also have disorders where there's lack of sexual drive, and if you're younger, and that's the person to go to for the gynecologist. So urology is typically anything that deals with this stuff down here for male and female, but if it's something of a sexual nature, male patient will go to the urologist or if it's something of a fertility issue, a male patient would go to a urologist. But if it's female, they can go to the gynecologist. Now, nowadays, a lot of gynecologists have a subspecialty here called urogynecology, which their fertility specialist will see both the future or potential mommy and daddy. So that's a urogynecologist, and that looks like a beautiful both A and B question, doesn't it? Now, nephrology is urology is kind of like their own little department by themselves, and they are also typically a surgical service. Nephrology is medical and surgical, but mostly medical, and that's why they are under the Department of Internal Medicine. So nephrology are kind of like subspecialists. And that when I was an intern, that was my first tour of duty, was in the nephrology clinic. That was an adventure. And what did we focus on? This thing right here, the kidney, okay? Now this is anatomy physiology. This is nice to know. When you get into anatomy physiology, this is the kind of pictures you should be looking at. But we're in medical terminology, so we're gonna focus on the medical terms. So we already talked about cysto, which is the urinary bladder. So I could take a scope and perform cystoscopy, right? That's easy. Vesicocele, I could have a herniation or a protrusion of my urinary bladder, and that's called the cystocele, also known as a vesicocele. Now, what's a hernia? Well, you see all this tubing here, right? This tubing, and there's also tubing in here. There's lots of tubing in here. They all have coverings. Now, if the tubing is sticking out of the covering, it's going to cause some discomfort, it's going to cause some pain, and it's going to cause some physiologic problems, including obstruction. So that's called a hernia. A hernia is something that's sticking out that shouldn't be sticking out, something that's out of its sheath or out of its covering. And here, the urinary bladder could be sticking out of its covering, and it could be popping out, and it could cause pain. Your glomerulus is a microscopic filtration system that is in your kidneys, and it's microscopically located here on the outside portion of your kidney. Just know that glomerulus is synonymous with kidney. So if you had glomerulonephritis, that means you have a kidney infection and a specific kidney infection. Meato is a meatus. Meatus is a structure of, so it's not meatus, it's meatus, right? Because remember, this is not English. This is Latin with a touch of Greek. So any opening like this, that's a meatus. There's an opening here. There's a urethral orifice or urethral meati, right? More than one opening. Nephro means kidney. So if I had a nephroma, I have a tumor of the kidney. If I have nephrocarcinoma, I have a cancerous tumor of the kidney. Renal, that's easy, we already overwent that. Pyelo, that's your renal pelvis. And many times that's also synonymous with kidney. So your renal pelvis is this area right here. So you got to think of it like a funnel, and this major funnel here that goes into your ureters, right here, this area here that's covered with all these renal arteries and vein here, that is your renal pelvis. And that area, if it gets damaged, we need to perform a pyeloplasty, which is this word right here. Uro means urine, uremia, right? We already learned of the other emias, like hyperemia. So emia means blood condition. Ure means urine. Now, what does the urine, how do we make urine? See these blood vessels? See this blue and this red going inside the kidney? Well, it goes inside the kidney, and then the kidney filters the blood and removes all the nitrogenous waste or any extra nitrogens, usually in the form of ammonia. Now, if that thing gets gummed up and we don't have good filtration, you're going to get all that nitrogenous waste in your blood, and you'll have something called uremia, also known down here, if you look at here, azotemia, which is excessive amount of nitrogenous compound. Uremia and azotemia is not a good thing. It's a sign of some kidney failure, and it can poison my patient's blood. And we all know, where does blood go? It goes everywhere. So if there's nitrogenous waste or poison in my blood, that poison is going to be everywhere, and that is bad news. Urinary, of course, pertaining to the urine. Ureterosclerosis, your ureter. It could have a stenosis. Here's your ureters, and you could have ureteritis, and ureteritis, inflammation, infection of this tubing. It could close off that tube and cause stenosis or a narrowing. Another thing that can cause narrowing is this thing right here, lithiasis, abnormal condition of stone or calculus. Calculus means a single stone, calculi, multiple stones. And if you have that, you will definitely have ureterostenosis. Urethrocoel. We already talked about the suffix "seal" before, right? With this up here, cystocoel. You could also have a herniation or swelling or an outpocketing, something sticking out that shouldn't be sticking out in the level of your urethra. So right here, and that's an ouchie, right here, right? Anything in there in the nether region is an ouchie. Sorry, I'm not using the proper medical term, but it's gonna hurt like the dickens, pun intended. Azotemia, we already went over. Lithiasis, stone, we already went over. Let's see, another potential question. Now, ureter and urethra. Good, thank you for asking that because it's so close. Whoever named these two things was just evil. Your ureters are the tube that connect your kidney to your bladder. And you have two of them because you have two kidneys. But your urethra is connecting your urinary bladder to the outside world. So that's the thing you pee out of. That's your urethra, and there's only a single one. But your ureters, there's two of them, and that's from your kidneys to your urinary bladder. But your urethra is from your urinary bladder to the outside world. Thank you for asking that. That always gets messed up because they're so close. And whoever named it that way is just a jerk. Dialysis, we already know. Dia means complete or thorough, right? I don't like through or across because that's trans. Lysis is the breakdown of, and that's what your kidneys do. They dialyze your blood. They process of removing thoroughly all the nitrogenous waste and all the extra things that shouldn't be in your blood. And that's dialysis. Another term for dialysis is hemodialysis. And we're going to show you a photo, a little diagram in a minute, where there's two types of dialysis, peritoneal and hemodialysis. Nephropathy. Any problem or any pathology with the kidney is done by a nephrologist. So they are experts at nephropathies. And that's bad news because if my kidneys don't work, I won't be able to deal with a whole bunch of things. And you'll learn in anatomy and physiology that the kidney not only filters the blood, it does like 5, 6 other really important things. Nephropexy. Now, all this entire kidney is held in together by all these ligaments and musculature and all these things. And when we do a kidney transplant, or if I have to remove your kidney, repair it, and then put it back in, I have to perform a nephropexy, because if not, the kidney will fall down in here in your nether region. And we don't want that because then it's going to cause obstruction and torsion of this ureter. Okay. And then you'll have nephrotosis. That's not good. Downward displacement or prolapse. Right? So we have to perform nephropexy. We have to make sure that thing's sewn up in the right place. Lithotripsy. Lith means stone. Tripsy is the process of destroying stones. And we use that with sound waves. We also use little tiny explosives too. Really crazy what nephrology can do. Polyuria. We already went over this when we talked about the 3 P's of diabetes mellitus. Polyuria means excessive urination. Polyphagia, excessive eating. Polydipsia, excessive drinking. And those were the 3 P's of diabetes mellitus. Here's some stones, and they're in these little funnels called calyces. And this big here, this big funnel here, that's your renal pelvis. So if that thing gets damaged, right, we have to do a pyeloplasty. Or you could have, if this has an inflammation or infection of this area, that's called pyelonephritis. Here is that lithotripsy, also known as ESWL, or extracorporeal shockwave lithotripsy. Now, if you look at this word, it looks like a 25-cent word, but not really. Litho means stone. Tripsy means to crush the stone, and we typically use sound waves. Extracorporeal. Corpo means body. Extra means outside, right? And shock. What are we using? Shock waves, right? So it sends the shock waves through, and then it breaks up the stone. It's kind of neat how it does that. So the now you could have it has kind of to do with the prostate, but if you see here, let's look at this. And prostate's of course in the male. Here's your prostate. Your prostate is a gland. You have your urinary bladder here, and then your urethra, and the prostate gland is right here. So if you had prostatitis, it's going to mess with your urethra. So you're going to have erectile dysfunction, and you're going to be peeing funny, right? But stones have to do more with genetics, diet, and the amount of salt and sugar within the patient's system. Percutaneous nephrostomy. Now, let's look at this word. Percutaneous. Per means through or as of the cutaneous means skin. So right through the skin, I'm going to stick a tube, right? And I'm going to create a mouth or a hole called a stoma. So that's percutaneous nephrostomy. So if I want to get the urine out, right? I don't want the urine to pass down here because maybe I did some surgery here. I use a percutaneous nephrostomy tube, and then I empty out the urine that way. I looked it through here. Pretty neat, all the Frankenstein stuff we get to do on our patients. And we call it Tuesday. Well, even though today's Monday. Rectocele, cystocele. This is very, very common. Let me make this bigger. For mommies who love having kids, because what happens to your pelvic floor when you have a kid? It gets stretched out. It gets big, and then it gets small, big, then it gets small. Then the pelvic hole won't hold the urinary bladder very well. And then what will happen? The urinary bladder will start, see how it's sinking and then sagging into the vaginal canal. And it could cause pain, it could cause discomfort, and increased chance of urinary tract infections. And you could see the rectocele as well. Now, when it gets really bad, you could also have, what do you call it? A colpocele, which is the herniation of a vagina or a prolapse. The vaginal canal, once these muscles get really loose, will go out. And that's not a good thing, right? And also the same thing with rectocele. If mommy laughs or they cough real hard, the rectum will start sticking out. And that's not good because the inside should stay on the inside, the outside should stay on the outside, and it has increased chance of what do you call it? Bacterial infections. But you could see how all this musculature here supports all these tubes. But if you had 9 babies, 8 babies, the most I ever delivered, I delivered a woman who had 9 live children and 11 pregnancies, and she did have a rectocele and a colpocele, and had a lot of UTIs. What is the name for the opposite when the vaginal canal increases in size? Well, it's not increasing in size. The wall that holds everything in gets kind of loose, and then this stuff falls through, right? Because you got to think all these tubes get held in by connective tissue and muscle. But what happens when you get baby, no baby, baby, no baby? It's going to stretch all this stuff out. And I'm not talking about 1 or 2 children. I'm talking about 6, 7, 8 children, and within close proximity of each other. So to summarize, the hernias or the prolapse that could happen. You can have a cystocele. Oh, I'm about to sneeze. Oh, COVID. Oh, all right. Lovely. Right? Oh, you can't sneeze in the gym. You can't cough in the gym. They look at you like you have typhoid. Okay. So you look at this. This is your urinary bladder. You see how it's sticking out where it shouldn't be sticking out, right? Right here. Well, that's a cystocele. And over here, the rectum, right? This tube here, it's supposed to be straight and going straight down. You see how it's sticking out here? And sometimes it even sticks out over here when it gets really bad. And that's a rectocele. And if the vaginal canal here, if that starts to prolapse, it's called vaginal prolapse, or also known as a colpocele. So cele, the suffix, means herniation, something sticking out that shouldn't be sticking out. Here's cystoscopy of the urinary bladder on a male patient. Of course, here's the cystoscope, right? And nowadays, wonderful video connection. And you can see here, whoop, we go right through here. And then here's the prostate. We can check the prostate. And of course, we check the urinary bladder. No. This is microscopic. And I mentioned that filtration system. Here is your glomerulus, or that tuft or little like dust bunny of capillaries. This is where the magic happens. Microscopically, there's like 200, 250,000 of them in each kidney, something like that. Don't quote me on that. I think it's closer to 400,000. So this is where filtration of the blood happens right here. And this is called your glomerulus. So if you had glomerulonephritis, you would have inflammation or infection of this area, and your kidneys would not be filtering the nitrogenous waste very well. And that's a sign of, you could get azotemia, you could get a whole bunch of bad things happening. Urine dipstick. If you're in any of my clinical classes, we get to play around with urine. Here's a stone. Okay. Now, look what happens with the stone. It backs everything up, and it could cause hydronephrosis or hydroureter. Hydro means water. So it backs everything up. And all that pressure, it causes pain. And you could see how it can move all the way up. And see this stricture? Then the stricture is called stenosis. Okay. And this is actually an exaggerated tube. It's very, very small, and it's very, very thin, and it's very easy to mess this thing up. Polycystic kidney disease. You have a whole bunch of cysts, right? And that's not good. Poly means many. Let's look at this real quick. Acute renal failure versus chronic renal failure. Now, acute renal failure means your kidney stopped working like right now in the last 12 to 24 hours, okay? Classic example would be infection, or I always quote this case. I had a 25-year-old patient riding his Kawasaki Ninja motorcycle on I-95 in New York City, and he crashed. And then while he was crashing, one of his kidneys ripped out. And then that means his kidney won't work. So hence, he had acute renal failure. And if you have renal failure secondary to something like hypertension and or diabetes, that's called chronic renal failure. By the way, acute renal failure, we can fix real easy. Chronic renal failure, that's bad news, and it kills millions every year, especially diabetes related. Everyone's all hyped up out of COVID. CRF kills millions of people, but it's not news. It ain't cool, right? Aha, Francis, I'm ahead of you. I told you what causes renal failure. Anything that would stop the kidneys from doing its job. So if that happened like within 12 to 24 hours, like an acute infection, or I shot you in the back and blew out one of your kidneys, I'm really sorry if I'm very graphic today. I was watching with my kids those true, true Hollywood crime movies, or not Hollywood crime movie, but it was a documentary on like these teenagers who kill people. That's what I do in my time. I was just so amazed. And CRF, let me go back on topic before I lose you all. Chronic renal failure, remember, diabetes and hypertension. We're so focused on the rare. You should be focused on the thing that kills regularly. I had a student, she just got admitted to the hospital. She's only 28 years old. Blood pressure was 180 over 100 with acute renal failure. Wow. And you're barely out of your 20s and whew, you're already in trouble. BNO, we don't really use. BPH, we use all the time. Benign prostatic hyperplasia or benign prostatic hypertrophy. That means the increased size of your prostate isn't due to cancer. This is typically the profile of the patient's 45-year-old male, Caucasian, no real history of cancer, but then they have dribbling of their urine when they pee, or erectile dysfunction. BUN, blood urea nitrogen. How do we know you have renal failure? Well, other than, having your kidneys on the floor, your urea, or the nitrogenous waste in your blood, starts increasing, like your BUN. That means you're in kidney trouble. CNS is culture and sensitivity. Culture is we grow whatever bacteria that we find, and sensitivity is the second part of the test that tells us which antibiotic is best. That looks like a both A and B question. Catheterization. We usually use the word cath as kind of slang. CT, computerized or computed tomography. We already mentioned that. Cystoscopy, no one says cysto. ESRD, we always use that. End-stage renal disease. That means don't make any plans. You're done. There's nothing else we can do for you. We only have palliation. We're only going to try to make you feel better. Other than that, pray for a miracle, because you're done and doner. GFR, glomerular filtration rate. That's one of the tests that we do to see how well the glomerulus is filtering blood. And if the GFR goes down and the BUN goes up, guess what? That's kidney failure. Pay attention. Okay. HD, we don't call that HD. I don't know who calls it HD. IVP is intravenous pyelogram. Now, that's when we take, let me show you what an IVP looks like. So, intravenous, meaning to say is, we put something in your blood, pyelogram, right? So I want to see the urinary bladder. I'm not urinary bladder, the urinary, the outline of my kidneys. And then the ureter, and then you could see the urinary bladder here. Can everyone see here on this patient's left kidney that it's a kind of okay here, right? And then there's some stricture, and then whoopee. What happened here, right? You can see some stenosis here and some stenosis here, and then nothing. There's something up, right? So that's what an IVP does. We put this stuff that that kind of glows in the dark upon this kind of X-ray, and this X-ray is called a KUB, kidney, ureter, bladder, right? And the stuff we put in your blood intravenously makes your urine glow upon X-ray, and it makes it easier to to look at stuff, to visualize the kidney, ureter, and bladder, which is a KUB, and that's this thing right here, which is it's a X-ray or a radiographic examination. Remember, the Department of Radiology, that's the place you do X-rays. PD, peritoneal dialysis, we don't use that. I don't know who uses PDHD. PKD, polycystic kidney disease, yeah, maybe. PSA, we use a lot, prostatic specific antigen. Now, if you have benign prostatic hyperplasia or benign prostatic hypertrophy, your PSA will go up. Retrograde pyrography, we already saw a little bit of that, right? We could stick a tube, right, up your ureter, and it'll go up, and then up your urethra to your urinary bladder, up into your ureters, and it can go right into your kidney. Oh, here's a better look at it. I could stick a tube here, it'll go here, and it'll go whoop, and then it'll go to where we need to go see it. It's kind of neat. Where am I? Okay. TERP is a transurethral resection of the prostate. So we go through the urethra and to open up the prostate, and we saw a little bit on that on the cystoscope. It could be cystoscope or ultrasound guided. UTI is urinary tract infection. Now, it just means that the urinary tract has some sort of infection. It doesn't necessarily mean it's synonymous with an STD, but a lot of UTIs are STDs or sexually transmitted disease. Voiding cystourethrogram or voiding cystourethrophy. So what does that mean? Cysto means your urinary bladder, urethra, of course, and gram. So we want to look at your cystourethrogram as you're peeing it out. So let's look at a VCUG or VCUG. Hello? Is that me? Is that you? Here's one. And you could see how the imaging is kind of the same, right? Where I give you something to drink, right? And then in a couple of minutes, you're going to want to pee and you want to void, right? So you're going to want to pee. And then in a couple of minutes, you know, you're getting pee. Hello? Hello? Okay, just had to mute somebody. Sorry. Right? So if you're looking at this, you could see how it's the same thing as IVP, but it's like instead of sticking something, a needle in you, we make you drink something, and it's the same stuff. It's the same kind of thing. Okay? Alrighty. And those are some lovely abbreviations. Azaturia, same thing, increase of nitrogenous substances in your urine. Now, what is it? If you have azaturia, that means what? You got a ton of nitrogenous waste in your blood, and your body's trying to get rid of it. Diuresis is another way of saying increased urine, because a diuretic is what? A water pill, and it's going to make you what? Pee. Enuresis is involuntary urine. Now, when you're really, really young, your nervous system isn't fully developed, so that's why you wet yourself. But when you're really, really old, you know, you could have some nervous system issues, or like we mentioned earlier, you could also have some muscular sphincter problems here. And you know that the sphincter or the circular muscle is what keeps all the urine here. And if that's not good, right, especially baby, no baby, baby, no baby, or even some, you know, nerve damage, as in like an S2, S4, sacral 2, sacral 4 injury of your sacral nerve, you might wet yourself. Should I go over these? Nah. BUN already went. Creatinine. That's another thing. That's another test that we look at to see how well your kidney clears out substances. And creatinine is the thing. Creatinine is the thing that we measure. CT pyrography. We talked about this. That's ultrasound. It's easy peasy. Here's a catheter, right? And you could see there's an inflation, and then of course, if you want, we want to irrigate and flush it out. Okay, you learn all of that for those of you in nursing. Hemodialysis. Now, you see this hemodialysis? There's this huge machine made by this company called Fresenius, and it only does one thing when your kidney does like 6, 7 things. And this process takes hours, and it's excruciating because it drains you of all your blood. You get really, really cold and hungry and loopy. I do not wish this on my worst enemy. My father, God bless him, when he was alive, he's one of the strongest men I know, if not the strongest man I know. The first time I ever put him in dialysis, he wept like a child in pain, and it shook me watching my old man. Let me tell you, so it'll sink in on how much this thing drains the life force, which is your blood, out of you, just so it can clean it out of its nitrogenous waste. My father, when I was 6 years old, got mauled by 3 like junkyard dogs, and then he had to take and this happened all walking me to school on the way to work and school. And he got bit a couple of times in the neck, back, and arm. They stitched him up the same morning, and he had to get, back then you had to get these shots, and there was like 12 serial shots. And even though he was all stitched up, he didn't say a word. They asked, "Oh, Mr. Garais, you have to come back like, 4 or 5 times to get all the shots." He goes, "Hey, doc, I don't have time. I got to bring my kid to school, and I got to go to work." He took all the shots all at once and didn't flinch. That's my dad. That's the kind, he's jungle warrior. That's me and my sister used to call him that. Vietnam vet, you name it, right? Lived through so much, but the first time through dialysis, that first week, it broke him. And he was on dialysis for, I think, 6 years, 5, 6 years. And it took a little bit out of him every time. And it was so hard. So what is my message? Those of you who are pre-diabetic or diabetic or have hypertension, please deal with that. You don't want to deal with it when you're at this level. This is the thing that keeps me up at night because I'm pre-diabetic. I used to have hypertension. Now I don't. I don't take any meds for either because why? Because I had to change what I got to change because I don't want to end up in this chair, and neither do you. Oh, by the way, dialysis has to happen every 3 to 4 days for the rest of your life if you have any kidney problems, and that's rough. So that's my commercial. Hope I scared you. Hemodialysis. Now that's hemodialysis. This is peritoneal dialysis. This is another thing that your large and small intestines and your peritoneum, which is the covering of your abdomen here, is it filters things and it takes nutrients and then it gets rid of wastes, just like the kidney. Well, if you have kidney problems, this is another way we can also do this. Or we put a port right here, stoma, right? And then we take this cleaning solution, like 6, 7, 8 bottles for a typical 70-kilogram male. And then I have you lie down, and then I use gravity to make this stuff all go in your tummy. Then your tummy gets really big, and then I slosh you around, no lie. I move you around back and forth, and then I put the bottle on the floor, and then I empty it out. And I got to do that 6, 7, 8 times until the dialysis is, or this stuff is clear. And it takes hours, and it's a pain, and it has to be done. Both of these things has to be done in a sterile environment, because having a port here, and if anyone's ever seen the port access to hemodialysis, it's like this. It's about the size of what do you call that? A garden hose in your neck and in your arm. It's not fun, and it's painful, and it is a big time source for infection. Okay, so again, get this to your patient. What's better? Do the diet, just walk a couple of miles on the treadmill, or have this in your life? I think the treadmill's better. This is a stent. We use it as extra tubing. So if there's and that's what a stent does. It bypasses things. So it has an extra tubing just in case there's a severe stenosis or cancer or something in here. Diuretic we talked about, anti-diuretic, right? Anti is against peeing. So your ADH or anti-diuretic hormone tells your body not to pee. Antibiotics. The key thing about antibiotics is make sure that that medication is only for bacterial infections. You don't use antibiotics on a viral, and you don't use antibiotics on a fungus, unless you want to get sued. So here is our thing that we've been doing for the last week. These are the cases. 1 or 2 of you asked me, where are the cases? Well, they're in the back of all the clinical chapters, from the cardiovascular chapter on. And this is what I'm making you guys do. Start making questions based on this history. So, for example, let's take Mr. Jenkins here. What kind of questions would I use using these words? I would put this case on your final exam. So no more am I going to be asking things like, what's the prefix? What's the suffix? Which is pretty I don't know. It's pretty elemental to me. Not elemental, elementary, right? You guys are better than that. This is college, right? So I could ask you things like, what was the patient's history of present illness? It goes, you could tell, I could ask, what is the meaning of dysuria, right? It goes, did the patient have any, it goes, pain or discomfort while urinating? So if you see dysuria, of course he did. He also had frequency, meaning he was peeing too much. So I could ask, upon Mr. Jenkins' HPI, which is his history of present illness, he goes, did he have a UTI? Did he have cancer? Was he urinating too little or too much? He was urinating what? Too much, right? Oh, he also had cancer. There you go. Why were we admitting him? Because we want to do surgery. We want to do a colectomy. What surgery specifically was he admitted for? Well, ectomy, to remove his colon. So I could ask, A, remove his colon, B, cut into his colon, C, perform plasty or surgical repair in his colon. You could easily see how I can ask that question. What did we do before? It goes, when was the catheterization performed? And it's preoperative. Was it before, during, or after, right? But did we do it? Nope, not possible. Why? And he goes, we told Dr. Moriarty, but we'll see why. Past medical history, negative for negative for TURP or transurethral resection of the prostate. He didn't have any urological trauma, or he never had any VD or an STD related to any of his urological anatomy. He had a hemorrhoid, bilateral inguinal hernial repair. I could ask. When we repaired his hernia, did we repair the left side, right side, both, neither? Did my patient have hypercholesterolemia, hypocholesterolemia, eucholesterolemia? None of the above. He had a spontaneous pneumothorax. If my patient had a spontaneous pneumothorax, where was he admitted? Was he admitted to the Department of Urology, Psychology, Pulmonary Medicine, or Internal Medicine? And of course, pneumo means lung, pulmonary medicine. So they're the ones who probably did the chest tube. He also had BCC, which I don't believe because he's African American. Basal cell carcinoma is skin cancer, but maybe he worked outside a lot, because people of color don't get basal cell carcinoma too much. But if you're light skinned and you're outside a lot, not a good idea, right? Normal cephalic. So his head was what? Normal sized. He had no problems. EENT within normal limits. He had no nodes. He had no lymphadenopathy, right? Remember lymph nodes? No bruit over his carotid. That means when I put my hand on his neck over his carotid arteries, I didn't feel any rumbling or poor circulation. If you know your grandma or grandpa has poor circulation, feel their neck. You're going to feel a rumbling. It's really weird, especially if they're hypertensive. Clear to auscultation and percussion. That means I looked at his chest, everything was okay. And that is PE, his physical examination. Heart, no murmur, no problems. Abdomen is soft, non-tender. That means nothing hurt, no masses palpable. That means I didn't feel any masses, but he has some distension. That's okay. Genitalia normal, rectal. We had a digital rectal examination, and it showed that he had BPH, benign prostatic hypertrophy. Assessment or diagnosis, he had BPH, and he's status post colon resection. That means status post, meaning we already did the resection. It's done. And it's done because he had carcinoma of the colon, and he also had carcinoma of the skin, basal cell, right? Admit patient for surgery, perform the colectomy. So you could see how I could use these words relying to these case, and I could ask you questions. So I'll leave the next one to you guys. So that will be your discussion for this week. Rosa Huggins. Or maybe you want to do Mr. Jenkins. Either one, pick one. Copy and paste this case, and then give me 5 multiple choice questions relating directly to this case. And that will be your discussion for this week. Let me put it in while I'm here. Discussion 6. So add a new discussion. Someone's stealing my chips. Looks like it's my daughter. Get out of here. Don't steal my chips.
I think it's already in there.
Did I put one in there?
Yeah, I think it was this morning.
Yeah, you did.
Thanks. My Alzheimer's is kicking in. Leave page. I always say Alzheimer's because I had a patient years ago, and he was a kid, like 12, 13 years old. And he was trying to tell me that his grandmother, who he took care of, had dementia, right? I was asking him, oh, does he forget, does she forget things? And oh, here it is. Does she forget things and things of that, things that matter? And then he told me she had Alzheimer's. And at the time I was really tired. I'm like, Alzheimer's. And then it was like, it's one of those things where normally if I was awake, I would have put it together that minute, but it wasn't one of like 8 hours later when I'm doing the charting, when I'm actually putting in quotes the word ALLTIMERS. So who's the fool now, honestly? So with that being said, it's 6:51. Does anyone have any questions? Let me stop the recording.